we can see first of all the side ligaments, the lateral ligament on the outside, right knee, and the medial ligament on the inside. And as you twist, it's very common to actually stretch that medial ligament. So this is a very commonly injured ligament, and if you do injure it, it tends to heal very well by itself. But it's quite important, particularly if it's stretched a lot, that you're managed in a brace with your knee slightly bent. Inside the knee at the front, we have the anterior cruciate ligament. And this ligament, which is this one here, and it controls two things. It stops the shin from coming too far forward on the thigh, and it also controls rotation of the knee. And when it ruptures, the central rotation control point changes and the knee becomes unstable. And patients experience this sensation of their knee falling in and out of joint. And we call that the pivot shift phenomenon. And it's because they've lost this central control point. The back ligament, the posterior cruciate ligament, which is here, is less important for rotation, and it's much less likely to get injured as part of this type of injury pattern that we see. Now, inside the knee are the shock absorbers, and as you twist, you can damage these. And you've got one on the inside, the medial meniscus, and one on the outside. And they look like this in real life. They're fairly tough. The end of the thigh bone is round, and these menisci are also round, and they take the load from the thigh into the shin. So at the end of the knee, so separating the two bones, we have the femur or thigh bone and the shin bone. And separating the two bones are three layers. There's a layer of cartilage on the end of the thigh bone, and there's a layer of cartilage on the top of the shin bone. You can think of this like a carpet on a floorboard, and it's about 4 millimeters thick. And then we have the shock absorbers, one on the outside and one on the inside, and we call those the menisci. When people say I tore my cartilage, they're talking about tearing this structure. So separating the thigh from the shin are three things: joint surface, meniscus, joint surface. Slightly confusingly, the joint surface is also called cartilage, so two different types of cartilage. And it's very common as you twist the knee with an injury to damage those shock absorbers. And when you damage them in this type of situation, it's quite A, debilitating, and B, if we can get our hands on them, particularly early, we can usually stitch them up. So to summarize, when you injure your knee skiing, you can damage your medial ligament, most commonly. That we can normally treat with very, very effectively without any kind of surgical intervention in an appropriate brace with the knee slightly bent. You can damage your anterior cruciate ligament. Often people don't cope without that, and they need to have that repaired, which is the new concept that I've helped to develop, or reconstruct, which is a procedure we've had for many, many years. And we can also damage these shock absorbers, and we can stitch those up.